It's a great scene, and it is about fathers and sons, and I get all verklempt every time I see it. I've seen that movie 10,000 times. As I said, Ray and I agreed that it's the 11th best sports movie ever made. As much as we love it, we each have one specific problem with it. I'll let Ray tell his first, and then I'll give you mine, which was in that scene itself.
Mine might be in some people's mind a bit of a nitpick, but okay, I'm a bit of a nitpicker. So there's a scene in the movie where, and you all have seen it, you all understand what the premise is, that these old ball players come back. They come out of the cornfields onto the field and resume their careers. And the first guy to come back is Shoeless Joe Jackson, who's played by Ray Liotta. And in the film, he comes back, he meets Kevin Costner, he goes to the field, he picks up the bat, and he's going to step in and take a few swings. And I'm sitting there watching it thinking, I'm sitting there watching thinking, this is pretty cool. And then Ray Liotta steps to the right side of the plate, and I said, wrong. Shoeless Joe Jackson batted left-handed. Now, you may say that's a bit of a nitpick, but my feeling is, if you're going to go to all the trouble of bringing Shoeless Joe Jackson back from the dead, you should at least have him hitting from the right side of the plate. So that was my issue. Glenn, this is a little different.
This is my nitpick with the movie, and it was in that scene itself. So you have this great lead-up where the guy who comes out of the woods, the guy who eased his pain, the whole thing, turns out to be Kevin Costner's estranged father. When he died, they died on bad terms, and this is them coming back together. Is this heaven? No, it's Iowa. Hey, Dad, want to have a catch? I mean, it really is beautiful, and it leads you, I'm getting a lump in my throat and the whole thing. And so then they're going to have a catch. And Kevin Costner picks up the ball, and with that crash Davis arm, by the way, Kevin Costner was a college baseball player. He's really got athletic chops, right? So he picks up the ball and he throws it to the catcher. That guy's name is Brown. The actor who plays the catcher is named Dwyer Brown. So Dwyer Brown catches the ball. I don't know if you saw this the way I see it, but he catches the ball, he goes like this. And he throws me like a 6-year-old bitty ball player. I couldn't get past that part. So, but it's a great movie. A couple of notes to that. You saw the movie, the character Moonlight Graham that Burt Lancaster was based on an actual real character who played one game in Major League Baseball, never got to bat. That was a true part of the story. One other little note, you notice at the end they have all of the cars coming to the farm, right? The thousands of cars. If you build it, they will come, and all these people are going to pay money to watch the baseball games, and Kevin Costner's farm is going to be rescued, and that's the big payoff. When they filmed that scene in Iowa, it was before they had CGI special effects. They actually had to have real cars doing it, and basically every local from 20 miles away got in their car and did it. The problem was, when they all got on the road, nobody could move. It was the first traffic jam in the history of Iowa. And so they're off helicopters shooting this, and they don't know what to do because it doesn't look like anybody's moving. They had told all the people to tune into a particular radio station for instructions. So everybody had this radio station on, and the people in the helicopter said, if they just turn their lights on and off, it'll look like they're moving. And they did, and that's how they got the scene. So that's that scene. So that's the movie, and we love that movie. Any thoughts, questions, comments, complaints? Okay. Anything else? Okay, let me present our next doctor. Coming up next, this is Dr. Joseph Lombardi, who is a leading vascular surgeon with expertise in minimally invasive endovascular therapy Treating all forms of vascular disease, Dr. Lombardi specializes in complex and minimally invasive aortic reconstruction, as well as lower extremity arterial disease and carotid stenosis, which he's going to tell you in 25 words or less what that means. I will just tell you what I learned about Dr. Lombardi. Dr. Lombardi's dad's name is Vince Lombardi. Dr. Lombardi's dad owned a meat store on Packer Avenue in Philadelphia. And whenever the Eagles would play the Packers, somehow the TV news crews would find their way to Vince Lombardi's Packer Avenue store. I present Dr. Michael Lombardi.
Thank you. As a South Philly Italian, I got to clear one hand because then I can't speak. So, how many of you played football in some days? A lot of hands, that's great. So my dad actually played with Vince McCauley. He was one of those guys on the streets playing at night with the lights on in the cars. So they were good friends, and it was like a big victory when Vince made it on the Eagles. So we were all pretty intimate about that time. But what's interesting is that as I grew up and my brother grew up, we started playing football on Sundays with the same group of guys. And then their sons would play, and for another 20 years we kept playing football on Sundays. I played football on Sundays, and was tackle, no pads, well through medical school. So I had to stop at some point because I was really getting my ass kicked. But anyway, how many of you know what peripheral vascular disease is? Show of hands? Not that many. How many of you had vascular surgery at some point in your life? Very few, a couple guys in the back. Good. Not good. Sorry. When you're here, that's good. So usually, when a patient comes to see a vascular surgeon, it's a result of a long-standing history of these risk factors. And these risk factors accelerate a process called atherosclerosis. You all heard of it. So that's hypertension, high cholesterol, diabetes, and smoking. So all 4 of those risk factors really combine give you all the prerequisites for developing peripheral vascular disease. And sometimes patients come to me when it's a little too late, but most often patients are recognized early by their family practitioners or their cardiologists, and they come and they say, hey, my legs hurt when I walk. And that means the muscles in your legs aren't getting enough oxygen when you demand more from them when you walk or you climb stairs or you run. And likewise, all the other vascular beds, the beds that supply your brain, beds that supply your belly and your gut, the things that supply, or the arteries that supply your legs. My job is to keep all that running. So when a patient comes to me, they usually have an artery that's weakened by atherosclerosis called an aneurysm, your belly, or somewhere in their chest or in their legs. Or they have a blocked artery that prevents blood flow from getting to their target organs, namely their legs, even their brain, and all the visceral vessels in your belly. So I'm a plumber. So I go in and I fix all that stuff. There are a lot of different ways. And you heard Glenn say endovascular. And that just means I'm using wires and catheters and stents and balloons to help treat those arteries in a minimally invasive fashion through a little puncture in the groin. And sometimes we can't be minimally invasive, but we really have to go and make incisions and do a lot of plumbing that's a little more risque, if you will. So what I think you heard from a lot of people here tonight so far is that you can prevent a lot of this stuff, and all of those risk factors, if you have any of those, puts you a little bit at risk. If you have all 4, you are at a lot of risk, and you really got to calm down and do what's called risk factor modification. So if your blood pressure is too high, you got to fix it. If your blood sugars aren't controlled too well, you got to fix it. If you're smoking, you should quit. Okay, if your cholesterol is too high, you should take a statin. Those medications that make your legs hurt. So all these little things can be modified to prevent you from seeing me. And if you get to me, that means things have gone and progressed pretty far. And then it's my job to help you modify those risk factors in addition to helping you have a nice lifestyle. A lifestyle without pain when you walk, a lifestyle without stroke, a lifestyle that prevents aneurysms from rupturing in your belly or your chest. So that's kind of what I do, but it's all based on a very similar process that Dr. Corin treats, and you know, we do our best. You're welcome.
Thank you, sir. Thank you. All right. Next movie we'll show you is the favorite sports movie of Tiger Woods, of Phil Mickelson, of John Gruden, of Eli Manning, of dozens and dozens of people, and maybe you. Oh, well, we already got it up, so I can't surprise you with it. I will tell you that if any of you know the movie Taxi Driver from the 70s, which is a classic movie, Robert De Niro does this famous scene of, "Are you talking to me?" You know that scene? Totally improvised. One of the great improvised scenes of all time. All it said in the script was, Travis talks to himself in mirror, and he improvised it. Like that great acting, the scene you were about to see is a brilliant actor who improvised this entire scene, did it in one take. They wanted to add about 2 or 3 minutes to the movie. They said, Bill Murray, can you do something funny? And this is what he did.